Yes, everyone's subject to it, unfortunately. We are legal officers from the Director of Public Prosecutions Office. My name is Madonna Fong. I'm a principal legal officer at the DPP's office based here in Suva. And I'll ask my colleague to introduce herself as well.
Good afternoon, everyone. My name is Darshini Kumar, and I'm a legal officer with the General Crimes Division at the DPP's office.
So we were approached by a professor to do a brief presentation on preparing of medical reports, the police medical reports, as well as presenting them as evidence in court. If there are any questions or anything, feel free to interject at any time. We have a PowerPoint presentation which will apparently be broadcast to everyone, and then I'll just go through each of the slides accordingly. Okay. Is everyone okay?
Right. We're very lucky to have you here. Very glad that you've come.
We're really honored, and this is definitely an area that we wanted some dialogue on.
Yeah.
Because ultimately, medical reports are very important pieces of evidence. We rely on them on a daily basis, simply because the work that we do, criminal prosecutions, unfortunately, more often than not, it has to do with a lot of injury, a lot of hurt. And a medical report is an independent piece of evidence that helps to prove one way or another one person's version of the story. Now, if they're claiming that they've been assaulted, they've been sexually abused, so on and so forth, the go-to is the medical report. This is the piece of evidence that all courts, and even us as legal officers, when we're doing a legal opinion on evidence in a file, this will be the go-to piece of evidence we want to look at to check on consistency of a person's story, whether there's independent evidence to prove whatever the story may be. So I'll just start off with our PowerPoint. Oh, I didn't do what you said to do, sorry. Yeah? This. Would be like a slideshow. Sorry, technical difficulties.
Somebody's not cool.
Aha. Oh, okay. So just an overview of what we'll be discussing today. We just want to give you a brief introduction on our office and the work that our office does, the Office of the Director of Public Prosecutions. We'll then just generally talk about how medical evidence is admissible in a court of law, criminal court. We'll be talking about the crux of the presentation, which is what we were requested to do, which is how to write or fill in the police medical report forms that are normally given to you when police officers bring in either victims or accused persons or suspects. We've been asked specifically to touch on sexual offenses, domestic violence, motor vehicle cases, and how to do reports on those or anything relevant to reports on those. We've added examining accused persons. More often than not, this may be this should happen regularly. That'll be explained furthermore, and how to fill out reports when this occurs. We'll also be talking about preserving the chain of evidence and how to be a prosecution witness. So our office, where Ms. Kumar and I work, the Office of the Director of Public Prosecutions, we're a constitutional office. We have been ever since independence. Currently, where we can be found, our office, our institution can be found under Section 117 of the 2013 Constitution. So what our office does is represent the state in all criminal proceedings. Any criminal case, really, the Director of Public Prosecutions, our boss, the Director, the DPP, he has powers, constitutional powers, in terms of having control of all criminal proceedings in Fiji. So related to that, it means that he can start proceedings, he can end proceedings, he can intervene in any cases that are of a criminal nature. And the crux of our work is prosecuting cases in all courts of Fiji. We also provide legal advices to police on all their cases. We assist with mutual legal assistance and extradition if need be. And generally, if it has to do with criminal justice or criminal proceedings, we are the go-to office in terms of providing legal advice to state agencies. So that's just a little bit about our office. So in terms of the laws in Fiji and providing medical evidence in a court of law, a criminal court that is, our governing legislation is known as a criminal procedure decree. Now this is basically our legal guidelines in terms of how cases are run. And under this criminal procedure decree, medical evidence or any report or any document that's prepared by a medical practitioner or a medical officer in the course of their profession or course of their work, it may be simply submitted, the report itself, as evidence in any criminal trial or proceeding. I've just put the actual section, the specific section that gives us the legal power to do that. That basically means that whatever report or document is prepared by anyone who's a qualified medical practitioner or medical officer can be just submitted as is in a court of law. And that will be given as evidence, something that the court can rely on in terms of proving a fact or even proving an opinion. Under the same section, once they receive the report, there's a presumption that the person who has signed the report is the person that has written the report, and also that the qualifications they list in the report are genuine. And that's the specific section there. Now, reports can be submitted as is, and if a report is tendered in such a way, then any person of the same expertise can give opinion on that report. So for instance, any of you as medical doctors, if a medical report is tendered into evidence and we need a doctor to actually give oral evidence in court, their professional opinion, they can therefore come and do this under this section of the criminal procedure decree. Okay, now in terms of writing the police medical reports, what's really, it's quite easy. There is a standard form that all police officers will bring to the doctor when bringing in an alleged victim of crime or even a suspect. So this standard medical report form, it's actually a new form that's changed to ensure that there are more evidence that was required in court is given. So the forms that are being brought to police now are new medical report forms. And they have quite standard sections, easy to read and easy to fill out. Now, the second point on my slide is that each and every section should be filled out as much as possible. And this is because we've noticed that medical doctors, practitioners, medical officers, what have you, they seem to selectively pick sections to fill out. We would request, this is basically a document that's going to be evidence in court. It has to be taken seriously, so each and every section should be filled out as much as possible. Now, we understand that your job is a very busy one, a very hectic one. Sometimes you're working 36, 48-hour shifts. The last thing you want to do is be meticulous about filling in some silly report, which it may seem at the time. But just keep in mind that this report is going to be evidence in a court of law. And for that reason, it is quite important that you keep in the back of your mind to be careful about how you fill out the report, that you fill out every section, and that you be as detailed as possible. Now, writing legibly is basically a common sense thing. There's always jokes about doctors writing that,
For good reason.
There's a lot of reports. We have a very hard time reading what the doctor's actually writing. It seems like a scribble, but that's more the exception rather than the rule. But it goes back to the fact that this becomes evidence in a court of law. So it has to be legible to any layperson, any Joe Blow on the street, because we have to be able to read exactly what you've put down there. Your evidence is so important. You're giving us contemporaneous evidence of what you've observed, what the victim or the accused person is telling you then and there at that very moment. So it's important that we're able to understand everything that you've recorded that becomes evidence in court. Now, we brought copies of the report, the police medical report that's normally filled out. I apologize, we don't have a soft copy version, just a hard copy. But we've basically, we're going to go through each and every section of the report. It's just those ones. We're going to go through each and every section of the report that's listed out there. So when you receive the report, you'll see that section A of the report, it goes right up to section E. Section A of the report should already be filled out because that is filled out by the police officer or the investigating officer. And that has basic information about the person who's to be examined and the case. So if you were to look at a medical examination form that the police give you, basically it's split up into 4 sections. It's quite self-explanatory, but basically you don't really have to worry about section A. It's filled out by the police officer. But it is important to look at because it gives you the first indication of why this person is in front of you for medical examination or why a report is required in that instance. Now, police fill out as much as they can, but if something is unclear from section A, you need to liaise with the police officer as much as possible. Because this, as I said, is your starting point. So unless you actually understand what exactly the case is about or what the allegations are about, if you do from the start, it'll help you in filling out the rest of the report. Now, going along with the slide, section B is the standard consent section. So this is actually protection on all parties concerned. Now, I'm sure you know it's quite a moot point that everyone should give consent to be medically examined. This section B puts out quite nicely everything in relation to legal consent. So the person who's to be examined has to sign the report. There's a section there that actually says that I consent to the doctor, and then the doctor has to fill their name out in section B5, so that it's clear that this person to be the patient has legally consented to you, the specific doctor who's going to do the report, who's going to do the examination, that this legal consent is there. So the person signs and dates that they consent to be examined, and or puts their thumbprint if the case may be. And as mentioned there, if the patient is under 18, it must be countersigned by his or her parent or guardian, and the parent or guardian is supposed to be present as well during the examination.
Can I ask a question?
Go ahead.
What if they refuse consent?
The only reason they would refuse, let's say an accused person, then you shouldn't do the examination.
Okay.
Then the only way around that is that the police have to come with a court order.
Yeah.
And the court order, well, basically, being a court order, you then operate under the powers of the court order to go ahead with the examination.
Sure. And if the patient's 16 or 17 and their parents can't be located?
They should still have some sort of legal guardian. Police should be able to know the person who is in charge or has care of the person. So that should try to adhere to that as much as possible. Sometimes it's not possible.
Yeah.
If the patient, him or herself, can sign, ultimately, if it's a person about 17 or 18, there may be some leeway, but it's always safer to, if they're under 18, they should have someone.
I suppose the reality, I'm thinking of the emergency department on a Friday night, it's 3 o'clock in the morning,
Yes.
they've been out drinking with their friends, there's been an assault. This is a sort of common scenario, I suppose, and their parents either maybe aren't even in this town, or
I see.
I guess just as a practical point, how would you proceed? Would you leave this till a later date, or
It should be done as soon as possible. If that is the case, the police officer should
be able to
be the
advise
person to bring the parent or
some
the
kind
guardian.
of legal guardian?
Some sort of
Okay.
person in that
Yeah.
capacity. So rely on the police officer who should bring someone, because even if the city is not that big, if they're in another town, hopefully they can just be
Sure.
over in a matter of hours.
Yeah.
But the sooner the better.
Sure.
I do understand that point though. Ultimately though, if it's not possible for the guardian to be there, you could still do a report. The only thing is that to actually give this as a report that they actually consented to the medical examination would be difficult. But you could still be summoned as a witness in terms of what you observed that day.
Yeah.
For instance, something that's as plain as day. He had a huge gash on the left side of his forehead. It looked like it required so many stitches. or you give a police statement if the person needed urgent treatment, for stitches or whatever, and then you'll just be summoned as a witness in terms of how you treated the person.
Yeah.
So report aside, this is a person, if they're reading out, you can't say, let's wait, the parent has to be there to sign this report. Go ahead and treat, and you can always then just do a plain police statement about how you treated the person and all the things you observed.
Yeah.
And ultimately, we can then just lead your oral evidence and your statement on that.
Yeah.
Okay.
Can the teacher sign the consent?
It should be a parent or legal guardian. There may be some argument that if they're in school, teachers and head teachers sort of have a sort of control over the students. So it would depend on the hour of the day, but it should be a parent or a guardian. Unless the teacher is a guardian.
Sometimes the police officers bring the statement and the police report. Do you have to fill both? They usually say for us to fill the statement and the police report.
I have it in my slide, but yes, you should fill both the report and the statement. The statement is important. There's a section in our criminal procedure degree on criminal proceedings that normally you can't be summoned as a witness to give evidence unless you've done a statement. So that's why the statement is so important. The statements are created to give evidence as part of fair legal play and legal procedure to the accused person. So these statements are just given as way of disclosure for them to understand the gravity or how much evidence prosecution or the state has against them, and that they use it as part of their defense later on during the trial if they go to trial. But it is important to also fill out the statement. It doesn't have to be extensive. I've seen a lot of people just say, I, Dr. So-and-so, examined this person on this day, and attached herewith is the medical report. Because then they sort of go together, the statement and the medical report. But the statement is important to fill out as well and sign. And also the statement can contain any other particulars that you think doesn't really fit into the medical report. So, like for instance, if there was a struggle, or why you went on to treat a person when there wasn't consent signed, anything like that can sort of be put into a police statement, which you can't really put into the medical report. Does that answer your question?
Yes, thanks.
Okay. All right. So that's on consent. There's a section for declarations of interpreters, and that's if you have someone who needs a special interpreter present, so that they sign and it's clearly understood by the court that the examination was done in another language, and if need be, that the interpreter has to come to court to verify that they explained everything in the particular language needed, and that the report was signed, consent was given fully and freely, and so on and so forth. Okay. Now, ultimately, the parts that you...
Sorry, can I just interrupt for a moment?
Okay.
Does that have to be an official interpreter, or can it be a nursing staff member who can interpret on your behalf?
It can be anyone who knows and is fluent with the language that the person, that the patient needs to be discussed with. So it can be anyone. It doesn't have to be someone with the credentials of an interpreter. Just someone, as long as someone who's fluent in the language, I believe, yes, that should be fine. All right. Now, as I was saying, section D is really the meat of your report in terms of the particular sections you'll be filling out by hand. We're working on checking if there's actually a soft copy of this report that we can maybe start handing around. Some people find it easier to type, but ultimately, for the most part, until probably the future, you just have to fill out these sections by hand. So we've started from D10, but the section D actually starts from D8, and D8 has the details that you fill out of yourself, who you are, the hospital or the health center that you're at, your position in the hospital, your contact details, your qualifications, your years of experience. So that needs to be filled out in D8. I'm sorry it's not part of the slideshow, but when you get the report or a copy of the report, you'll see that that's there. So fill out every single section. Again, it's important because it's going to be evidence in a courtroom, and if we're to presume your qualifications, you must at least put down what your qualifications are. So that's what that section is about.
think what I'll do is take one of these and scan it and send it
You
to
can
people.
keep all those
Is that
copies.
okay?
Yeah, we had brought them for whoever
Sure.
was going to.
I'll scan one and I'll email it to everyone so you guys in the ambassador and the TOPA can have a look as well. Okay.
Now D9 gives specifics about the time, the date, the location that the examination took place, as well as if any other person was present. So list all these details down as specifically as possible. Now D10. So this talks. This section is history as related to you by the person to be examined. Does that mean anything?
Yeah. I don't know, there's some interference noise coming from somewhere, but I'm not sure where. Okay, that's better.
Sorry, it's probably the storm that's happening in Latoga. I'll switch our things off.
Okay, thanks.
Should we continue?
Yeah,
Okay.
continue, yeah.
All right. So as you can see in the slideshow, I've written try to note as much of what they say as possible. It's a very small space written there, but of course, please attach additional pages. Take as full a history as you can. The reason that this is important is because ideally, a person who is a witness, ultimately the alleged victim or complainant, will become our main witness in the trial. They will give the same story to police, they'll give the same story to the doctor, they'll give the same story under oath in court. So this history is relied on by both prosecution and defense counsel to check what exactly they said to you as the doctor when you asked them to tell you what happened or what had happened to them. So there's sometimes a lot of argument that, well, you didn't tell the doctor this, and now you're telling the court, why should we believe you? And the go-to answer for most of these complainants or victims is that, well, I did tell the doctor, but it wasn't recorded. It's nothing new. It's the same for police officers recording actual statements from them. But if you record as much as you can or as much as possible in terms of history, it's just why we like to be specific about that. Although it's not, of course, possible to write down word for word, but if as much as possible you can record everything that they say, and even in their own words, that would be really appreciated. So after history is D11, which talks about initial impressions. So as I've written there, in this section discuss, your impressions as soon as, from when they walk in, when they're giving history, their reaction, their appearance, their mood, whether they're crying, all those kind of things. This is relevant when we actually get to court and at trial, just to provide an indication to us what this person was like at the time. So even if, they're disheveled, torn clothes, hair everywhere, whatever may be the case, we would like that if that is what you observe, that is your impression of the person or the patient, that it's all listed down here. Because it does help later on when they say that they came to the hospital crying and their clothes were torn. The first thing defense will say is, well, the doctor never wrote anything in initial impressions, or the doctor never wrote down that, so, they'll say that it bears doubt that this person was crying in front of you when telling her history, or his history. So initial impressions is just basically filling in that according to those things that I've written on my slide. After D11, D12 goes to specific medical findings. So in the brackets, just on the medical report itself, it says, if relevant, mark on diagram at Appendix 1 and use glossary at Appendix 2. Now, we find that a lot of medical reports don't pay attention to this because they'll write down the specific medical findings, but they don't back it up with the diagrams. Diagrams are really helpful to the court, to us. As much as possible, you should do both, match both. Your specific medical findings in D12 should match your diagrams in the Appendix 1. Because there's like a full body form back and front, and then there's another section where you can do some specific diagrams, like if you have to draw the vagina or the anus, or someone's ear, or someone's other internal regions, whatever the case may be. But most doctors only fill out D12 and sort of neglect the part where it says, relevant marks should be on the appendix on the diagram. Sorry, if you see the form, you'll understand where the appendix are.
Yeah, I'll just make a comment there. It's a really good body diagram, like some trauma forms use or burns forms. So actually, I think it actually simplifies making a report if you use the diagram, because you can mark on it where the abrasion or laceration or stab wound is, rather than trying to describe it, which is always much harder. So basically, it's a body diagram front and back.
Thank you. Alright, Yes, it is much easier to understand diagrams. Plus, if you happen to use technical medical terms, it would be very hard to understand when you're talking about, I don't know what the terms are, but you know, when you use your technical medical terms to describe a part of a person's body, which is not easily understood, but a diagram is. Okay. Now, after specific medical findings, there's a section called Other Observations. And so this is for any distinguishing marks, clinical or otherwise. So in there, most people just write if there were any tattoos or any old scars. This is important to fill out because by the time the matter comes to court, they could have multiple scars. And when they're showing the court or the judge or even us, whatever the case may be, you know, how do we know which scar is relevant to what? So if they already have tattoos or scars or any other distinguishing marks that are worth noting, fill that in D13 so that we can clearly distinguish, let's say by the time trial comes around, which one would relate to what, if that makes sense.
Yeah.
All right.
Can I ask you what the average time is for something to go to court, say an assault case?
It really depends. For trial, could be 1 year, 2 years, 3 years.
Yeah.
So that's also why.
Yeah, certainly in the UK and Australia, we're told sort of 5 years. So you're never going to be able to read your old notes 5 years ago.
That's true. That's exactly right.
So you should
Get it right.
You should write it as if you'll just be going back and reading it and remember that patient in 5 years' time. So that's the kind of degree of detail you want.
That's exactly right. Yes, thank you so much. Well, that's because that's the reality. This case probably doesn't go to trial until 1 to, let's say, best case scenario would be within a year, and that's only for special cases. For instance, if they're children or they're migrating or they're maybe in a critical condition and they may pass away. So, I'm sorry. Or they're remanded prisoners, and the trial then goes quickly. But for the most part, it's a good. That's a good practice. Pretend that you're going to have to look back on this report and remember this person or this patient or this examination in 5 years' time. So record it in that way. The clearer your notes, the more detailed, the better you'll be able to give evidence, or even the better the court can just rely on your report. A lot of doctors move away. Of course, they get transferred, they migrate, they're studying somewhere else. So under the laws, we can just give your report as is. But for the most part, we're prevented from doing that if the report is illegible.
Yeah.
And hence why we have to summon the doctor, him or herself, to come and tell us what exactly have you written in this report, because we cannot understand what you've written.
I must admit, it's a very good form, and the better you fill it out, the less likely you are to go to court. So think about that as well, that it's in your own interest to fill it out well, so that you don't have to be dragged to court as well in 3 years' time.
Okay. All right. After any other observations, then you have the section for professional opinion. This is quite crucial in terms of a legal standpoint, because this is where you put down what your opinion is in relation to everything. Everything else would be specific, factual. This professional opinion should be your opinion about what you think in relation to what you've learned from police, the history given to you by the patient, your specific medical findings, any other findings. You then put down your opinion in that section. Now, it's a professional opinion, so it should take into account all those things that I mentioned. And in your professional opinion, what can you say in this report? What could you? It should sort of match what you might say in court.
Excuse me, I'd just like to interrupt for a moment. I'm just a doctor who's been here for 3 months here in Lautoka, but the doctors here have asked me a number of times how to fill these forms out, particularly in the case of rape. Now, none of the doctors here at Lautoka have any sort of qualification or training in the assessment of a rape patient, and yet they are repeatedly asked to give their professional opinion. Now, as far as I'm concerned, as an emergency physician, I don't know how to examine a woman for rape, and I think it's quite unfair for these doctors here to be giving a professional opinion on something that they have no formal training or qualifications on. If, for instance, you know, some of the doctors here have been asked to go to court and comment on whether or not a rape has occurred based on whether or not the hymen's intact. Now, first of all, I would disagree that that was indicative of rape in the first place. But second of all, how can they give a professional opinion when they don't have any qualifications whatsoever in order to make a judgment?
Okay, I'm glad you brought that up because that is quite a sticking point. It'll come up later in the slide, but the professional opinion is not about whether a rape occurred. It's just simply what your opinion is in relation to your specific medical findings and the story that's been relayed to you. You actually shouldn't put down that you think the person is raped or has been raped or whatever the case may be, because rape is actually a legal finding that happens in a courtroom after a trial or after the person has pleaded guilty, whatever the case may be. So really, professional opinion would simply be actually an impartial clinical discussion on everything that you've observed, what you've heard from the history, and your specific medical findings. I do take your point though that it may be important to know what exactly, it's not that because you're trying to say that the person has been raped or not, it's just whether, in terms of everything that you've been told by the patient and your specific medical findings, what can you say about it from a medical standpoint? You actually shouldn't go into whether the person has been raped, because a lot of people think that is the case. And the thing about hymen being intact, that's been an old chestnut for a while, even though the hymen can be broken in so many different ways. It's just, I think the best thing to do is go to consistency, because that's all that can be asked of you anyway from a medical standpoint. You cannot pinpoint who or what did whatever injuries. You can say that there are injuries there, and for the most part, what you would want to see in this professional opinion section is simply whether there's a consistency between a story and whatever specific medical findings there are. You can't, as you mentioned, it's true, you can't say whether a person has been raped, you can't go to the truth of a matter. You can only just give your professional medical opinion of, this person has told me a story, and this is what I found specific, these are my specific medical findings, and then just make an opinion on those different things. But also within that section, it says age of injury, causation, gravity. So for instance, if the person has been specific about, I was hit, I was stabbed with a knife, and then you do find a wound that looks like a stab wound, that seems to be how many days old. So then you just give your opinion about that. So speak to the medical findings itself. It's not so much about the offense or whatever the case may be. It's about your specific medical findings, the stories that has been told to you, and whether they seem consistent. For instance, if a person says they were beaten and stabbed with a broken beer bottle and everything, and the only thing you found was a bruise, you say, well, in terms of the story given and the injuries I found a bruise that appears to be 3 days old, inconsistent or consistent, whatever the case may be. A lot of people think that means you should say, oh, well, I think the person was raped or whatever it is. But really, it's just that we want a medical opinion about your specific medical findings and whether there's consistency with a history related to you by the patient.
Yeah, I'll make a comment there because this is raised everywhere in the world by emergency doctors. It's not unique to Fiji, and we often feel very uncomfortable because we don't have specific forensic medical training. But what you're writing is, as a doctor of your level and your experience and your specialty, what your opinion is about what you have heard and what you have observed. And usually it's actually very obvious that the patient's told you exactly the truth. In my opinion, this is consistent with the stated cause told by the patient, or it's totally incongruous. So don't be worried that you have to put all this detailed stuff. It's not the case. You just have to really state whether you feel that is consistent or not. So this is always a fear raised by everyone in all of these talks around the world. So I just want to reassure people that you're not a forensically trained medical doctor, but you do see a lot of injuries commonly every day, and you can state whether it looks pretty consistent or it looks totally inconsistent. But don't be expected to know the difference between a 6-hour bruise or an 8-hour bruise or a 12-hour bruise, because you're unlikely to be able to accurately do that. You're not a forensic pathologist.
Yes. Does that answer your question?
Yeah, no, I have to admit that my question was specifically about sexual assault. I think most of the doctors at Lautoka are more more than capable of describing injuries and giving an estimation of time and duration and things like that. But repeatedly we are asked to do examinations for rape, and hopefully your ongoing slides will give us some indication of what's expected.
Okay, I hope as well. Well, we can discuss it further. Yeah. In the section itself, you know, what's written in the brackets is your professional opinion. It exactly says age of injury, causation, gravity. So it really is just a professional medical opinion on if any injuries have been found and what you can say about it. If you mean that with sexual assault cases, you know, you can only talk about it generally. Ultimately, you still have more expertise and experience with the look and feel of a normal vagina compared to the vagina that you've just examined. So you can list down in the professional opinion if there's been cuts or lacerations or bleeding or whatever the case may be, and just your general knowledge of how long that would take to heal or possible, you know, causations of such injuries. You put that down in your professional opinion in that sense. Okay, we'll just move on. We'll probably come back to that again. Okay, so after professional opinion is D15, which is clinical management. The sections are pretty specific, so you just list down as much as possible anything that needs to be listed down there, including if you've ordered any further investigations and additional information. Yeah. It's pretty specific. It's just factual recordings that the doctor does in terms of filling out this section. And then the summary and conclusions, any concluding remarks that you can make in terms of the overall assessment. Okay. Now, we were specifically to speak about sexual offenses. So, just generally, under the criminal code, these are the different sort of sexual offenses that a person can be convicted of. So first and foremost is rape, which in law is simply, it's gone quite general now. The old law for rape used to be vaginal, penile to vaginal penetration, which would constitute rape. But under our new crime section, rape includes penile anal penetration, if you penetrate the vagina with a finger or a thing, or an anus with a finger or a thing, and even forced fellatio. So rape is quite broad legally. We also have an offense of sexual assault or indecent assault, which is just unlawful touching of someone in an indecent area without their consent. Indecently insulting, annoying, you probably won't get reports medically about this. This is just actions outside of a person that's normally done, for instance, flashing or saying indecent things to a person, things like that. Defilement, the issue with rape, the difference between rape and defilement is just an issue of consent. And defilement charges is basically having sexual intercourse with a minor, anyone under 16. And then there's unnatural offenses with animals. I've never actually seen someone who needs a medical report on that. And incest is having sexual relations with anyone related to your nuclear family, fathers, mothers, sisters, brothers, up to half brothers and sisters. So these are the offenses. Now, why I've only put this slide up is just so that if you happen to know that this is what the person is charged with, don't feel pressure to actually write down that the person has been raped. Like for instance, that may be what a lot of doctors feel they should write. But these are legal findings that are determined after the matter has gone to court. So, as much as possible, if you know that this is what the person has been charged with, you shouldn't use the specific terms here of the offense in your report. Because you cannot say that a person has been raped, because that's a legal term of art. You cannot say that a person has been defiled, really, because these offenses are actually legal terms which are proven later on. Okay. So, sexual offenses, for the most part, and quite generally, all courts, defense counsels, prosecutors want to know, first of all, it may be difficult because of the time of the report, but focusing on all areas of the body and specifically the genitalia. We've noted that a lot of medical reports only look at one area, like the vagina. There should be a focus on all parts of the genitalia, including the anal area, and so on and so forth. one of the prosecutors asked me to say, all orifices, please put a note there. If you've examined it, put a note there. Were there any findings? Because the history given may be quite general, but then other pieces of evidence could go to show that all sorts of injuries were put upon the person, which is not just vaginal but anal. It's just something that one of the prosecutors asked me to report on. Also, sometimes some medical reports focus only on the vagina, when really we want a very detailed examination from head to toe, because they may have told the police or even the examining doctor about certain things that were done to them to restrain them, or that they had a knife pointed at their neck or towards their body, or whatever the case may be. So if there's any resulting injuries that would support that, we would hope that it would be put down in the medical report. But basically, sometimes we get either just, one part of an anatomy or just no full body examination at all. So even though it's specifically a sexual assault case, we would hope that, there's a full body checkup and that the genitalia specifically is examined in all forms. It's also important to note down just the demeanor of the person when they're being examined. It may not seem relevant at the time, but if they're in pain or they're specifically if they're in pain, quite a few. There's some medical reports I've seen where they say tended to palpitations, which is always a good indication. If the person was crying, cringing, whatever the case may be, in terms of any specific examinations that were done, that should all be listed down. Again, diagrams. Diagrams are always very helpful. We don't see enough diagrams being drawn. Maybe it's something that's a bit difficult to do, but it really helps in terms of us determining what you're trying to discuss. If you're specifically talking about the labial folds or how something looks, if you can try and draw it. The consent also covers photographs for the consent section. So if either specific diagrams or even photographs can be done, that can be then attached. Also, there's always a case where further investigations are ordered, HPV, other sexually transmitted investigations, or vaginal swabs are done and given, but we only reach the trial and then we find out there hasn't been any follow-up. So we would hope that there'll be more follow-up on that.
I suppose the question there is if the report goes to the police officer?
Yes, it does.
So most of those tests take a number of days or maybe even weeks to come back. So I guess how do you marry up the results with the report?
Just you would know the police officer who has come to you with the report. So you would just call that person up and say, look, that victim that you brought in, the results for some further investigations has been done. Could you please come and pick it up? And they should come and pick it up.
Right.
Just follow up with the police.
Because one of the main issues with emergency is that obviously you only see patients for a short amount of time and you don't necessarily follow them up. Sometimes another doctor might follow them up in a clinic, for example. Particularly stuff like rape, if they've been really injured, then they might be referred to the obstetric gynecology service. They might then see them, they may follow up the results, or they may go back to their health centre. So I guess these are the issues, because even our acute results here take many hours to come back, and in this sort of case the patient's unlikely still to be there, so I can see why you guys don't get the results.
Yes, we hardly ever get follow-up on the results.
Yeah.
That's a responsibility of the police officer, the investigating officer, who should follow that up.
Yeah.
But if you happen to just keep in the back of your mind that these results will come back, and they'll probably come back to you because you've ordered them, or whoever the case may be. So just sort of try and call the police officer if you have these results in hand and give it to them, or pass it on somehow.
Can I also ask, are there any forensic doctors employed by the police? Are there any specific?
Just the forensic pathologist, to my knowledge, Dr. Ponusami.
And that's just for deceased people? Or?
Yes.
Yeah.
Just for
Okay.
deceased people. In terms of, we don't have any specialists, forensic specialists. No. It took a while for us to actually just have a pathologist.
Yeah, sure.
Yes, resources are always an issue.
Yeah, and I suppose with photographs, because photographs are often much better than drawings.
Yes, that's true.
But again, the ability to actually get them printed off and attached to a report, I can't see how that would. There's not a real mechanism for that to happen at the moment.
That's true.
We don't even have photocopiers in our department. We're that resource poor. because I'd actually encourage all the doctors to keep copies of all their reports for themselves as well. But again, I'd say probably the easiest thing is getting a smartphone and taking a picture of your own report, because we really do lack basic infrastructure like photocopiers in our department. So I think that's probably one of the biggest barriers to doing this sort of thing really well. It's they're time poor and they're resource poor.
I see.
Yeah.
Okay. But there will always be a copy for the hospital file.
Yeah.
I've been told.
Yeah.
So I guess there's always that, because the original one original kept with you guys, one original kept with the police. And there are times when the police lose their originals, so they always have to refer back to the medical officers.
Yeah.
And I have some doctors do just make copies for themselves, because they know they may have to refer to it again when they have to go to court. So that's a good habit. That's if you can, make a copy for yourself of your own report.
Because the problem is that often hospital records get lost as well.
Oh, do they? Okay.
They get left in someone's office, or they're inaccessible because a visiting team has come, and the reality of life is paper records get lost. So I think particularly for high profile cases where you have a feeling you'll have to go to court, for example, someone's stabbed in the chest or something like that, I'd definitely encourage all the doctors to keep their own copies. If it's just a minor thing, the run-of-the-mill stuff, maybe not so much, but things that are going to have a lot of police and media attention, I think I'd always keep my copy of the report. That would be my practice.
I have seen doctors who do that, and that is a good practice. Okay,
In
so
the case, in the case of investigations, I think the practice now is, especially for sexually assault cases or rape cases, we usually take our swabs and give it back to the police officers who brought them. I think it's processed in their lab.
it is, yes.
So, that's for the investigation.
Oh, that helps with follow-up, that's good. Yeah.
Yes, I understand. If vaginal swabs are taken, it's just basically given, labeled, sealed, given back to it should be given to the officer who's given you the report. So just one officer. And then really it's up to them to keep following up and provide us with the results. You don't have anything to do with that. The only thing I raised would be investigations involving STIs and things. I think that's done within the hospital itself.
Right.
That's what I was told. So it's only the vaginal swabs and things that for sexual assault cases that are taken, sealed, and given back to police. Because police, yes, we have.
So that's the forensic to swab for semen or.
Yes.
Rather than to STIs,
Yes.
Okay.
Yeah. So those swabs are given just back to police. So
Okay.
they take the swabs and give them back to police. So just as I mentioned, you may know that the person will be charged with rape, or the person is saying, I've been raped, I've been defiled, I was sexually assaulted. But just keep in mind that these are legal terms of art that you should probably prevent, or don't get trapped into saying that a person was raped or defiled or whatever the case may be. As was mentioned, the person who raised the question earlier, when you're given an opinion or a conclusion or a summary, really you're just being asked, as mentioned, in terms of your experience, in terms of your expertise, what your professional medical opinion is about the injury that you've seen, how it could have been caused, and it really is impartial and clinical in that sense. Because rape, defilement, sexual assault, these are all things that have other elements which a medical doctor cannot give evidence to. That really is just the person themselves. So, as much as possible, you don't, and actually you probably shouldn't use such terms. Don't get trapped into thinking that you have to say that a person was raped, because really you can't say. Medical doctors can't say. They can only say that they found such and such injuries, they were told a story, and what your professional medical, clinical opinion can be on how these injuries were caused. And that's really what we'd like to see in the reports. We don't require that you say a person was raped, because really you can't give that evidence. You can only talk about what you've seen, and in your medical expertise and what you can say of how these injuries were caused. Is it consistent with the story? If they say that a bottle was used and you see bruises, or a knife was used and you see nothing at all, basically it just goes to consistency, and it's a medical opinion. It's not an opinion on whether you think the person was raped or you think the person was defiled. So that's the importance of sexual assault and things.
I think all this discussion probably just means we need to work together with a number of people to maybe come up with a guideline to guide people who are asked to examine a rape victim. I know that there probably are differences in practice around the country, and depending on your facilities, that, you know, for example, here in Suva, I'm not sure what happens, but maybe the obs-gynae team handle them. I know that there was a bit of discussion around that. But obviously, if you're in a small hospital, it's going to come down to you. So it's probably worth us thinking about this as something that we could provide a guideline on, to give at least the basics about what you need to document, what tests you need to do, etc.
It'll also be obvious from the report your qualifications and
Yeah.
your position in the hospital. So, you know, if it comes to court and you can safely say, well, at the time I wasn't a specific OBGYN or whatever the case is. I recorded it as best as I could with my expertise. But professional opinion simply means a professional medical opinion. So that's a clinical, documentation. Okay.
Sorry. Hello. Just one question. I've had a few cases of the young children being sexually assaulted. Basically, they've been taken away from home and say that basically they want to be in a relationship with someone much older than them, but then their family say that they've been raped. And basically, I know we just have to do in medical findings, but you still could see a lot of emotional turmoil. So I just wanted to know what happens with them after you've written your report and they go back to the police. Does the police get social welfare involved, or are they just?
It really.
Do they go back home?
Yeah, it really would depend on.
I mean, because I just had to call social welfare, but then I really don't know what the procedure is after we've done our report.
The police
because a lot of them look like they need counseling.
Yes, the police officer should normally take carriage from there. Sometimes you can refer them for counseling if that's possible, but ultimately the police officer, if the person is a child, the police officer or the person's parent or guardian, unless they're the accused person, takes over from there. We normally also ask police to try and arrange counseling for them, and it really depends. In terms of, going back to what you said, there may be cases where it's the parents who have filed the police report, so then, they go on a basic witch hunt and they track down the girl or the boy in his or her boyfriend's house or girlfriend's house and then drag them to the hospital. Is that sort of what you're talking about?
Yeah.
Okay.
Yes, sorry.
Yes. It's hard talking to a microphone anyway.
Yeah.
So because it's their procedure that if the allegation is rape, so then it's sort of like A, go get a medical report, B, come back, record the statement, C, give the case to the crime officer, decide, D, interview the suspect. So a medical report is sort of just part of the procedure. That's why you would see people would come to you even though the allegation may be years old. But it's just that a medical report being a necessary procedure, you go ahead and fill out a report or whatever you can find. But after you do your examination, if you think that the person needs counseling, you could tell the police officer. It also depends on the age. Ultimately, when after the report is done, you hand the patient back to the police officer as well as the report, your statement, if you've taken any swabs or anything, and then they go back to the station and then they fill out their police statement. So that's what physically happens to them. And if their parents, as their legal guardians, have reported, they would probably go back to their parents, unless of course the parents are the people who are perpetrators or alleged perpetrators. Does that answer your question, or?
Thank you.
Okay. In terms of social welfare, you do have powers under the Child Welfare Decree. That's basically if you have walk-ins, not so much from police, but you'll probably get patients who come in and you think that they're being abused, like child abuse. So then you fill out a report under the Child Welfare Decree and you hand that over to social welfare. But if you want to follow up, or if you know or you think that social welfare should be involved, you can give the permanent secretary a call. But if it's a police case, police normally take care of all those details, getting them to counseling or taking them back to their parents, and trying to deal with whatever issues they may be having at home. Okay. Were there any other questions about sexual offences in general, specifically?
Regarding the same, along the same lines, like here in Nandi, every second day or every second week, we having police officers come in with these minors because their parents complain about them running away with their boyfriend, and usually the police report is just written there to find out whether the hymen is intact. And when you ask the girl whether they've slept with their boyfriend, they usually said yes, we've slept from last year until now. I was wondering, because whatever you will find is considered whatever with whatever. Yes. So, and there's nothing, there's no injuries or anything, just the vagina is not intact, obviously.
Yeah, okay.
So,
if that is the case, just fill out the report as per each section, and if you find nothing, write down that nothing was found, or hymen not intact. People always refer to the hymen. It's going to take a lot of training and I think some time before we get past this hymen must be intact to prove virginity thing. But just fill out the report as much as possible, and it's important to also note if nothing is found, and so it can be shown that you did do a full examination, you examined the person from head to toe, and you found nothing. So you just write that down in your report.
Seems like a crazy waste of medical resources.
It does. As I mentioned, it's part of procedure, so that's why you're being brought this person who probably has no injuries, but it's part of police procedure to get a medical report on if it's a sexual assault allegation. That's why this happens.
This is the allegation being made by the parents to preserve their honour rather than the child.
Might be, yes.
Yeah, this is a theme in the West. It's not just Nandi, it's Lautoka as well. It's a Western theme, I think.
I think it's countrywide because it happens in the north too.
Yeah,
that much I know.
Yeah.
But yes, it's something, as I mentioned, it's basic, it's a necessary procedure for police officers. So they have to get a medical report in their police docket and attend to their police report. So this is why this is happening. But just fill out the report as detailed as you can, the history and everything, how the person appeared, and if no injuries were found, then write down no injuries. That's all that can be done. Does that answer your question?
yeah.
Okay. All right. So I know we're running out of time, so just moving on quickly. We also asked to talk about domestic violence. I've been very general because I wasn't sure, once the medical report is, easy to fill out, self-explanatory. Domestic violence has been focused on a lot lately after the passing of the domestic violence decree. It has basically put a legal duty on police officers to ensure that there's a no-drop policy if there's any sort of assault case, threats, or any domestic disturbance arguments that occur, whether they go past a house and they find out domestic violence is happening, or if they have reports, women or men coming to the police station and making a report. This decree has put on them a legal duty to ensure that they try to prevent or stop the violence as much as possible. So, yes, then now, in law, domestic violence has a specific definition under the decree. So, basically, in law, domestic violence covers any sort of violence, and I've underlined violence because there's a very broad definition legally of violence under the decree. So any violence committed, directed, undertaken by a person against someone who they're in a family or domestic relationship with. The thing with this decree is that it includes, when people think of domestic violence, they think of marital problems or people in marriages or relationships. Now with the passing of the decree, domestic violence, and the fact that it's violence of any sort against a person you're in a domestic relationship with, it now covers de factos, it now covers, fathers arguing with their sons, any sort of family or domestic relationship, and there's violence involved, that is now termed legally as domestic violence. So I think for the most part you'll be doing reports on assault for this domestic violence. Or what may be the case is that you're being brought a person from the police station. I think someone has spoken to me about this. They don't want to be medically examined, but they're brought by police because it's part of police procedure. So again, if they don't sign the consent to be medically examined, you can't examine them, or you shouldn't examine them unless there's a court order there. But more often than not, domestic violence simply involves all sorts of assaults, and the relationship between the persons is what's important for the court. If it's a case of domestic violence, it simply means in court that the penalties will be higher. It means that they can get a restraining order under the decree, the domestic violence decree, which is an order that can be obtained much easier than previously. So that's all that we can say about domestic violence. Was there specific?
I guess, how about if they're not brought by police, they just come in? I mean, this is something we actually see quite commonly with quite horrible injuries.
Okay.
And they obviously, because the severity of their injuries, the hospital is the first port of call, not the police.
Right. Okay. So if the person is coming, you'll probably find out either from history or whatever's related to you by either the patient or the family. Is there a procedure where you call up police?
Well, I suppose this is my question. I guess, I mean, my normal procedure would be, overseas would be first to get consent from the injured person to call the police, or ask whether they want the police involved. But I'm not sure about the Fiji law, whether it's mandatory to report to the police, or is it just depending on
I think
whether...
currently it's mandatory for child welfare, like for children, if you suspect child abuse. But in terms of